how about some health news this afternoon? We're on your side with this week's Ask the Doctor segment, brought to you by National University. And we're talking about Alzheimer's. November is Alzheimer's Awareness Month. And Dr. Dabe joins us to talk about that. Good afternoon, Doctor.
Hello. Good afternoon.
What do folks need to know about Alzheimer's?
4.5 million Americans are affected, and it progressively affects parts of the brain involved with memory and thinking. In the early stages, there's memory loss. Later, there can be behavior, mood, and personality changes. And the advanced stage is mental decline, loss of body function, so that folks need around-the-clock care.
So what do folks need to know about
If you're concerned about Alzheimer's for yourself or a loved one, 4 things you want to be aware of. The first is to recognize the early warning signs of Alzheimer's, which is memory loss, difficulty recalling recent events, repeating questions and stories. There can also be difficulty with performing familiar tasks like brushing your teeth or washing your hair. There can be disorientation, getting lost in your neighborhood, misplacing objects in your home, or increasingly relying on your spouse for planning and answering questions. The second is to get a doctor's diagnosis. The sooner you're diagnosed, the earlier you can start treatment. And although there's no cure for Alzheimer's, there are medications that can help with the symptoms. And third, you want to plan for the future. If you're diagnosed, you want to have your legal and your financial affairs in order and decide on who will be caring for you in the future. And fourth, take steps to increase your independence in the early stages of the disease by getting help with daily activities such as cleaning, lawn mowing, your banking. You can have direct deposit. You also want to make your home as safe as possible by installing grab bars, eliminating tripping hazards, improving lighting, and posting memory aids to remind yourself to lock doors and turn off appliances. And finally, you want to try to stay active as possible by socializing, participating in hobbies, exercising. The physical and mental stimulation is thought to help with managing the symptoms.
So is there anything we can do to prevent Alzheimer's then?
There is ongoing research. The best thing is to try to maintain your health and your exercise and your weight. That's thought to be linked with Alzheimer's, obesity, right?
And mental activities too.
And
mental
activities as well. Yes, absolutely.
You know what? We all forget things sometimes. I mean, Rick Perry during the debate the other night. But that's what's the difference between just occasionally forgetting and worrying about whether it's Alzheimer's or not?
It's a number of the symptoms that we mentioned together and having it happen over time repeatedly.
Okay.
Right.
All right, Dr. Dabe, thank you so much. If you have a question or a topic you would like Dr. Dabe to discuss, email it to us at newsdesk@cbs47.tv. The doctor joins us every Tuesday on our noon show, and of course, it's all brought to you by our friends at National University.